ABA in schools is a civil rights issue, not an IEP debate. Let's start here because this gets missed constantly. When a school blocks a disabled child from accessing medically necessary care, that is not an education dispute. That is a civil rights issue. The ADA and Section 504 were written to stop public institutions from becoming barriers to access for people with disabilities. Schools are public institutions, and when they interfere with healthcare, they cross that line. Applied behavior analysis is healthcare, not extra school support, not classroom help. Healthcare. And children do not lose access to healthcare because they walk onto a school campus. Clinically, this isn't controversial. Autism affects communication, behavior, self regulation, and learning across environments. Skills don't automatically generalize. Behavior changes by context. If treatment only happens at home or in a clinic, progress stalls. That's why ABA standards of care require treatment across settings, including schools, when that's where behavior occurs. Avoiding the school setting doesn't make care conservative, it makes it incomplete. Now, here's where the problem starts. Schools often say if it's not in the IEP, we don't have to allow it. That sounds authoritative, and it's legally wrong, because once we're talking about medically necessary ABA, we are no longer operating under IDEA alone. We are operating under ADA and Section 504, which are civil rights laws. ADA and 504 don't ask whether a student is receiving, they ask a different question. Is a student with a disability being denied meaningful access to a public program because of their disability? When a school blocks access to medically necessary ABA, the answer is yes. Here's a distinction schools blur, sometimes intentionally. Parents are not asking schools to provide ABA, they are asking schools to allow access to prescribed healthcare. That distinction matters. Under ADA and Section 504, schools must make reasonable accommodations to allow access to medically necessary treatment unless doing so would fundamentally alter the program or create an undue burden. Allowing a credentialed ABA provider on campus almost never meets that standard, especially when school is not paying for the service. And here's the line BCBAs need to be able to say clearly. Schools do not determine medical necessity. IEP teams are not medical authorities. Principals are not clinicians. District policy is not prescription. Medical necessity is determined by qualified healthcare providers, including behavior analysts, not by whether a service fits neatly into an educational framework. This is where schools try to reroute everything back to IDEA. They'll say, bring it back to the IEP team. We're already providing the supports. We believe FAPE is being met. But ADA and 504 do not hinge on FAPE. They hinge on access. Courts have been clear when the issue is access to medical care, not educational programming. Families do not have to exhaust IDEA procedures first. This is the same logic used in service dog cases. Schools cannot block medically necessary support simply because they aren't listed in an IEP. Another point schools often overlook. Once a school is on notice, it has legal duties. Notice can come from a parent, a physician, BCBA recommendation, or the obvious nature of the disability itself. Once on notice, the school must engage in an individualized, fact-specific analysis. It cannot ignore the request. It cannot rely on blanket policies like we don't allow outside providers. Blanket policies are exactly what ADA and Section 504 prohibit. Even if a specific accommodation truly isn't feasible, which is rare, the law still requires schools to explore alternatives rather than shutting the door entirely. So when a school says we don't allow ABA, what they're actually saying is we are applying a blanket rule instead of following civil rights law. That's not a preference, that's non-compliance. And this is why the framing matters. This isn't about turning schools into clinics. It isn't about schools paying for healthcare, and it isn't about replacing special education. It's about civil rights, and blocking medically necessary ABA blocks access to a public program. When that happens, ADA and Section 504 are triggered, whether the school wants them to be or not. So the takeaway for BCBAs is simple. ABA in schools isn't a favor, it isn't optional, and it isn't dependent on IEP approval. If a child needs ABA in the school setting to make meaningful progress, the law already supports that care. What's missing isn't permission, it's clarity. documentation, and the willingness to stop letting civil rights issues get mislabeled as IEP disagreement.